I decided when I was in medical school to practice internal medicine because I loved the depth and the breadth of it. For me, I couldn't narrow down what I wanted to do. I wanted to be involved in all the medical problems of my patients, and I also wanted to get to take care of them over a long span of time. So I enjoy the most being able to get to know my patients, their life stories, using that to determine how am I going to take care of them medically. But also, early in my career, I was able to switch gears and start to practice in an academic setting. A big piece of enjoyment for me was being involved in medical education for students, residents. When a colleague says, I helped them achieve their goal, or a student says, thank you for the mentorship. I was able to do this or that, or, get better at something. Or a patient was able to say, thank you for taking care of me. That to me was knowledge that I did something right, that not only did I make a good choice within my career field, but that I made a difference for the people that I was involved with. I have so many people in my life that I wouldn't have had I not gone into medicine. Being able to know that I created some curriculum that's long-lasting, that I was able to help somebody achieve their goals, that for me is, I think, the best memory I have. It's not just about the amount of knowledge you have, the amount of skill and expertise you have. While that's very important, we're all in here to take care of people. And the important thing is to always try to remind yourself, I need to be present, not worry about the headaches, the administrative responsibilities right now, the stressors. Be present, and I think that will bring everlasting joy in your career.